Good morning, everyone, and a very, very warm welcome to day two of CRAN's 2026 My Colorectal Cancer Summit. My name is Cassandra McCauley. I am the Chief Research Officer at CRAN, the Colorectal Cancer Resource and Action Network, and I am joined today by the wonderful CRAN team, our very dedicated volunteer cancer coaches, and the one and only Filomena Servideo Italiano, CRAN's President and CEO. Filomena, I will turn it over to you to welcome our participants this morning.
Thanks very much, Cassandra. Well, good morning. Good morning, my friends, and welcome to day two of CRAN's My Colorectal Cancer Summit, a wonderfully unique 5-day evidence-based event providing colorectal cancer patients and caregivers expert insights on the management of colorectal cancer to help them navigate their journey with confidence and competence. For 5 years now, we at CRAN have been convening experts across the continuum of colorectal cancer care to deliver evidence-based information as part of the annual training and certification requirements for CRAN's My Colorectal Cancer Coach program. We are so very proud of our coaches who provide evidence-based information and compassionate support through one-on-one coaching to our colorectal cancer patients and caregivers who contact us across the country after receiving a diagnosis of colorectal cancer. Last year, we decided to expand this annual training and certification program by opening the virtual event to you, our colorectal cancer patient and caregiver community, as silent viewers, so that you too could benefit from the depth and breadth of expert content being provided and delivered by a stellar lineup of expert speakers. And here we are today, delivering our second My Colorectal Cancer Summit. So a very warm welcome to you all, and in particular to our colorectal cancer coaches who are diligently undergoing training again today. CRAN is immensely grateful to you all. So on this second day of our summit, expert sessions are focusing on the surgical management of colorectal cancer, which also includes ostomy care, as well as the surgical management of colorectal lung metastases, and how coping strategies can be incorporated into a patient's treatment plan, and how sexual health can be optimally supported. CRAN's registered dietitian will also be joining us to speak to nutritional recommendations for optimizing treatment protocols. We have a full day planned for you, my friends, so sit back and enjoy. Thank you for joining us. We are, as always, proud to be hosting you. Back to you, Cassandra.
Thank you so much, Filomena, for that lovely welcome. And absolutely, we are so thrilled to have this event open to the broader colorectal cancer community. And a very, very warm welcome to everyone tuning in this morning. So before we get started with today's agenda, I'm just going to walk through a little bit of housekeeping notes and provide an overview in more detail of the day. So just starting with a little bit of housekeeping this morning. The summit is being recorded. So viewers at home are not able to be seen, and we can't hear you. So you don't have to worry about your mic or your camera being on or off if you're viewing from home. Now, each and every person who has registered for this event will receive exclusive early access to the recordings before they become publicly available. Later on, they will be available through our website as well. So we've got these wonderful, wonderful resources that are being recorded throughout the whole week. To view today's agenda, if you want to, within the lobby, you can just click on the Sessions tab, which is in the top right-hand corner of your browser. Within the lobby on your web browser, all sessions will be streamed into the lobby itself as well. Across the top of the navigation bar, users can also learn about our expert speakers, They can visit our sponsor web pages, and you can even see bookmark sessions within your personal itinerary as well. Please leave the lobby open in your browser during the summit. When each session ends, you will be prompted to rate the session. We'd really appreciate your feedback. We put a lot of time reviewing the feedback that we get from these events, and are very appreciative of any feedback received. After you've rated the session, you will need to return to the lobby to join the next session that is of interest to you. In the afternoon, you'll join using a fresh link. The links were all sent via email this morning, and you just use a separate link to come back in this afternoon. If you do experience any technical difficulties along the way, our team is absolutely ready to support you. We have our wonderful, wonderful communications manager, Alyssa Salmon, is available should you require any assistance at all. Please just shoot her an email on the email address on the screen there. For any new participants who are joining us this morning, I will briefly introduce our organization. So the Colorectal Cancer Resource and Action Network, or CRAN, as we're more affectionately known, really originated as a grassroots colorectal cancer information and support group all the way back in August 2006, which was actually 1 month after the passing of Filomena's father, who had been afflicted with widespread metastatic disease. Today, CRAN has very proudly become a national, not-for-profit, patient-focused organization. We are governed by an experienced board of directors. We're counseled by a really wonderful expert medical and scientific advisory board, of which many members are very generously participating in this event. At CRAN, we also have 2 patient advisory councils, and one of which is actually dedicated to the under 50 patient population, so the early age onset colorectal cancer patient population. And our patient advisory council members' past experiences with the disease actually help to inform our program development to ensure that our services are relevant and meaningful to those whom we support. In terms of our mandate, we champion the health and the well-being of Canadians touched by colorectal cancer, as well as others who are at risk of developing the disease. And we do this by providing support, education, and advocacy to patients, but also to their caregivers to help improve quality of life and longevity. CRAN has also expanded our patient-focused mandate, and we do so to serve multiple tumor type patients through areas including our HTA patient evidence submissions, so related to drug access work, through our educational events, our advocacy initiatives, and even some of our patient programming. And we do this all with the ultimate goal of reducing the burden of cancer in Canada, because this is our mission. So yesterday, we've introduced CRAN's My Colorectal Cancer Coaches, but they are just such remarkable humans that I really want to take the opportunity to highlight them again today, and truly at every opportunity I can. Our dedicated coaches, they stand ready to guide you as you live with or beyond colorectal cancer. They are amazing humans, very well versed in the management of the disease through this certification process. And they will offer you compassionate support as well as evidence-based information. So if you would like to connect with your very own coach, please feel welcome to reach out to Christopher Mamalides, who is CRAN's National Patient Programs Manager, as well as our young adult colorectal cancer coach. And it would absolutely be our privilege to connect you. And I know our coaches are ready with compassion and enthusiasm to support you on your journey. So today's summit agenda will begin with nutritional recommendations, and we'll be talking about how we can optimize treatment through nutrition with CRAN's very own Felicia Newell. After that, we have Dr. Shadi Ashamala joining us, and he will be with us to discuss the surgical management of primary colorectal cancer. So, the surgical management of the primary tumor in the colon or the rectum itself. After that, we will be discussing ostomy care and management with Mary Angel. Following the lunch break, we hope that you'll take a minute to relax and get something to eat over the lunch break. And after that, we're back with Dr. Mary Jane Esplin, another one of CRAN's Medical Advisory Board members. And she will be there with us to walk us through coping skills for the colorectal cancer journey. That will be followed by a presentation about sexual health for the colorectal cancer patient with Dr. Ann Katz. Lastly, we will be finishing the day talking about the surgical management of colorectal lung metastases with Dr. Marcelo Saipel. So within that presentation, we'll be talking about the procedures such as the in vivo lung perfusion or the IVLP clinical trial. So to all the folks at home, please do get comfortable. We have so much to learn today. I am so excited about this. Please be ready with your pens, your paper, your tablets or laptop, whatever it is that your preference is for taking notes. Following each expert presentation, our cancer coaches are actually going to enter a 15-minute closed and interactive discussion with our experts. And the reason that we do this is that so we can really ensure adequate knowledge translation with our coaches and a strong content acumen. We want to be sure that our coaches really have a good understanding of the evidence-based information presented so that they are then able to support you through your colorectal cancer journey. During the gaps in the schedule for the viewers at home, we do encourage you to take an additional 15 minutes and maybe take a movement break, get up and get away from your computer, rest your eyes a little bit, maybe grab a snack or some nutrition. So I very much look forward to learning along with our cancer coaches today and all of you at home through these wonderful expert presentations that our team has so diligently brought together. And with that, we might just take a very quick. Oh, Felicia is here. Hi, Felicia. So we are very fortunate to be joined today by Felicia Newell, who for our first session of the day, which is on nutritional recommendations for optimizing treatment. So Felicia is CRAN's National Registered Dietitian, and she has a Bachelor and a Master's of Science in Applied Human Nutrition. She's worked in areas such as research, education, healthcare, and private practice for 14 years. She has an immense passion for providing help and guidance to all patients, but especially to those fighting colorectal cancer. Felicia assesses patients for their nutritional needs and provides evidence-informed nutrition recommendations through our My Foods for Life program. And she does so to help optimize patients' body's ability to fight the cancer and to better tolerate their treatments. So a warm welcome to you, Felicia. I'll pass it over to you now.
Thank you so very much. I'm just going to take a moment and share my screen, which I think should work pretty smoothly, and then I will get right started. And can you see that okay, Cassandra?
Yes, that looks great.
Excellent. So thank you so much for the warm welcome and good morning, everybody. Thank you to everybody that's here for joining today as part of the 2026 My Colorectal Cancer Coach Summit. Again, my name is Felicia Newell. I'm honored to be here as CRAN's National Registered Dietitian. As mentioned, today we're going to be discussing nutritional recommendations for optimizing treatments. If you have any questions during the presentation, feel free to jot them down or put them in the chat. I'm really going to try to be efficient so that we have time at the end to go through your questions. And there's also a copy of the presentation available for anybody who would like to view it after the presentation. So just want to quickly go over the key topics that I'll be discussing today. Just to start, I'm going to dive into what kind of research that we use when it comes to our recommendations for cancer care. Next, we'll discuss key nutritional guidelines that are aimed at optimizing cancer treatment. We'll explore how nutritional needs shift during cancer treatment, surgery, or when managing certain side effects like fatigue and nausea. Misinformation, I always talk about that if anybody knows me. Just about nutrition in general is very widespread, but especially in the cancer space. So we'll talk about that and just how to address some of those myths, and why a patient-centered approach is so essential for providing support. And then again, we'll have some time specifically for the coaches at the end for some Q&A. So again, it's always important to understand where the information is coming from. Nutrition recommendations in cancer care are never just based on one study or one opinion. They're based on large bodies of evidence reviewed by international expert groups, hundreds and hundreds of researchers, physicians, health professionals. Organizations like the World Cancer Research Fund and American Institute for Cancer Research continuously review global research to provide evidence-based guidance. Clinical guidelines are from groups like ESPEN and the National Cancer Institute, also inform how we support patients during treatment, and just so many others. These are just some example of some international research bodies. It's also important to note that research, especially in certain areas like immunotherapy, metastatic disease, is still ever evolving, and just research in general is always evolving. So part of our role is to apply the best available evidence, like as a health professional, while also personalizing care. And I just want to take a moment to talk about something that we all encounter, personal stories or anecdotes. And these are incredibly powerful. We've all heard them, and many of us have our own, either for ourselves or for other people. For example, most of us might know someone who lived a long life without really following what we would consider healthy habits. In my case, my grandmother lived to 87. She smoked, she drank, wasn't very active, didn't have what we'd call a balanced diet, and she never developed cancer. But we would never use those situations as proof that those habits are safe or protective. That's just one person's experience. So the same thing is going to apply on the other side. Like we might hear people say in daily life, I cut out all sugar and my cancer improved, or I took a supplement and it cured my symptoms. And again, this may be their experience, but it doesn't mean that it will apply to everyone, or that it was even the reason for the change. A lot of the time, we know correlation doesn't always equal causation, and there's so many factors at play. That being said, two things can be very true. This doesn't mean that anecdotes are harmful or inherently harmful. Some are completely reasonable to try. Things like, having smaller, more frequent meals work for somebody, or adding smoothies, or adjusting food textures. Lots of things are very low risk and can absolutely be helpful for patients to try if it worked for somebody else. Where we need to be more cautious is when advice becomes extreme or restrictive, like cutting out entire food groups, following very rigid diets, or delaying or replacing medical treatment based on something that we've heard from another person or seen online. So this is where misinformation can cause harm, and why it's something that we always talk about. Um, so absolutely, personal stories, anecdotes, they're helpful, they matter, they can provide insight, but it's so important to balance them with high quality evidence to guide decisions, and especially when it comes to something as important as cancer care. And this is where one of the most important mindset set shifts comes when it comes to cancer nutrition. It often challenges what people think they should be doing with their diet. In many cases, general nutrition recommendations for colorectal cancer patients can look very similar to what we would recommend for prevention. Things like eating more fruits and veggies, limiting ultra-processed food, focusing on overall diet quality. Yes, we'll, shout from the tallest buildings and the rooftops always for people to do more of those things. Um, but sometimes during treatment, the goals might shift. And it might not become, or sorry, it might shift away from what we would see generally as like prevention or like a generally high quality healthy diet. The focus becomes more about supporting the body through treatment, and that means maintaining weight and muscle, supporting treatment tolerance, managing symptoms, preserving quality of life. These things kind of end up coming up at the top of the totem pole. And instead of focusing on perfect eating, we sometimes shift towards making sure the body is getting enough fuel, especially calories and protein. And this is often where I see patients struggle because there's a lot of messaging out there about eating clean or avoiding certain foods. But during treatment, weight loss and clean eating, perfect eating is not the goal. And in fact, unintentional weight loss, especially muscle loss, can negatively impact treatment tolerance and outcomes. So that's why, if someone's dealing with nausea, poor appetite, fatigue, the only thing they might be able to manage is something like toast, or a muffin or something like that. Um, that is okay in these situations because that is still supporting their body and helping them get adequate calories and protein. So that's why it's just really important to talk about that, yes, and why nutrition should be so individualized. And we'll talk about that more as we go through as well. Different treatments, of course, place different demands and changes on the body. So these are just some of many examples. With chemotherapy, there might be nausea and appetite changes. Surgery, going into surgery well nourished has been proven to improve outcomes, and recovery often requires a more intense focus on adequate protein and energy for healing and recovering. With radiation, especially if the GI tract is involved, we may need to adjust fiber and focus more on hydration. With immunotherapy, we're starting to see emerging research around the gut microbiome. And again, these are just some of many examples of why nutrition should be individualized. And this is just one aspect that might individualize it for that person. And this slide just builds on the idea that, again, nutrition is, of course, going to play an important role during treatment, but this is why it matters from a clinical perspective. So, when someone is undergoing cancer treatment, their body is, of course, under a lot of stress. Both from the cancer itself, which just generally puts added stress on the body, but then also from the treatments as well, such as chemo, radiation, surgery, are also going to add some stress to the body. Because of this, nutrition needs are often higher. And again, even if in a lot of these cases, appetite is lower. So this is where this kind of struggle comes in. Getting enough calories, protein, and fluids isn't just about feeling better day to day, which will, of course, have an impact, but it also impacts how the body responds to treatment, which is what makes it extra important. For example, adequate nutrition helps preserve muscle mass and physical function, which is important for maintaining strength and independence. And it also helps, again, tolerate treatment better. We see patients that are better nourished. And again, getting adequate calories and protein is what we're referring to in these situations. And we see these people do better. They're better able to stay on track with treatment, fewer dose reductions, fewer interruptions, better outcomes. This also plays an important role in reducing complications, including infections and hospitalizations. Um, and supports things like wound healing, especially after surgery. If an infection does happen, it helps people recover faster. So obviously very important for all these things, but even from a day-to-day perspective, it can help with, again, energy levels, overall functioning, quality of life. So nutrition is not just supportive, it's a key part of helping the body get through treatment as effective as possible. Um, and again, no one size fits all when it comes to nutrition in general, but especially for somebody living with colorectal cancer. There's not going to be one universal plan that works for everybody. Each person's needs will vary depending on their medical history, the stage of their disease, the type of treatment, how their body is responding, if they have, other comorbidities, etc. For example, somebody with diabetes or heart disease may need to balance their treatment with those conditions in mind. Others might have Crohn's disease, celiac, diverticulosis. All of these are going to impact digestion and nutrient absorption. And then there's the treatment side effects that, again, everybody experiences differently. So while the general goal is to stay hydrated, eat foods that are rich in protein, vitamins, antioxidants, electrolytes, etc., how that looks day to day will be different for each person. And something I'll just emphasize throughout, nobody should have to figure this out alone. Some people do have access to a dietitian regularly on their healthcare team, but sadly, many do not. So that's why I am so grateful to be available. Coaches can come to me for support, CRAN patients can come to me for support, especially for those that don't have access to a dietitian through their cancer team. But even if they do, I mean, the more support, the better. So absolutely always reach out if when in doubt or if it needed. So this is something, that I always include. These are the general recommendations, cancer prevention guidelines, but they're also just incredibly helpful for people they're feeling well and they're able to eat more nutritiously and kind of nourish their body with the nutrients that we need. So of course, again, whenever possible, we do want to prioritize nutrient-dense whole foods that provide energy, protein, vitamins, antioxidants. These nutrients are going to be very beneficial for healing, managing inflammation, supporting the immune system, helping the body recover. So the general guidelines are, what we all know and love. Eat more fruits, vegetables, fiber. Maybe 10% of the population gets enough fiber. Even when people think that they're eating fiber or getting good amount of fiber, they're probably only getting 10 to 15 grams. And women need about 25 and men need about 35 to 40. So um, that is just something that is always beneficial for somebody, or sorry, for people to take a look at, is just getting more fiber and plant foods because there's so many proven benefits. And to limit the consumption of, fast foods, ultra processed foods. I have another slide on this, so we'll into that in a little bit more detail. But ideally, keep these to within 10 to 20% of the overall diet, because that is what is realistic for most people. And what matters most is what we're doing 80% of the time. Limit consumption of red meat to about 12 to 18 ounces per week, and if possible, limit or avoid processed meats altogether, which would be your bacon, bologna, deli meats, those types of things. Um, Limit consumption of added sugar. This does not include natural sugar, so like from fruits or dairy products, but aim for less than 24 grams of added sugar daily. Limit consumption of alcohol, and I do have another slide on this, so I'll just leave that one at there. Include 4 to 5 servings of anti-inflammatory fats daily, such as fatty fish, nuts, seeds, avocado, and get adequate fluid, which is really important, not only for managing, fatigue, nausea, constipation, but so many other processes in the body require hydration. And then again, your needs are going to be increased, especially if you're going through treatment. So these are kind of the key general guidelines when it comes to just an overall, not only cancer prevention diet, but, colon healthy, all those good things, heart healthy even. Um, but it's really important to note this kind of shift in nutrition science, and especially going to be relevant for cancer patients. So we're moving away from focusing on single nutrients, and towards looking at overall dietary patterns. So in the past, we've kind of heard things focused on, over the past few decades, like cut fat, avoid sugar, remove one specific ingredient. But we know that this doesn't really reflect how people eat or how food actually works in the body. Again, it's the dose that makes the poison. It's what we're doing most of the time that matters most. So research is now kind of looking at how foods come together as a pattern over time, and why we talk about, plant forward eating patterns and whole food emphasis, Mediterranean diet, like these things have been regularly studied and do show to have very positive effects. Um, so this is especially important in cancer care because we know that nutrients don't work in isolation. Foods interact with each other in ways that support the body during treatment. That's why we moved away. Well, I don't think dietitians ever loved the term superfood, like, kale or spinach or whatever was a superfood at the time, because you can't just eat one food and expect it to be, health promoting for the body. It really is all the dietary pattern that works together. And then on top of that, really lifestyle that really kind of works together, holistically. Are you sleeping? Are you managing stress? Are you getting activity? Your nutrition, it all works kind of synergistically. So yeah, diet more so. That's why we say, instead of labeling foods as good or bad, it's about gradually improving the overall dietary pattern. Um, and this tends to be kind of realistic for people and achievable. So as I mentioned, the term processed food can kind of sound negative, and it does get thrown around, in a negative way, particularly over the past few years. But it simply means that a food has been changed from its original form, and sometimes for very good reasons. For example, pasteurizing milk helps prevent harmful bacteria and improve safety. Canning foods like beans or tomatoes makes them more affordable and accessible. Freezing vegetables helps preserve nutrients and reduce food waste. Um, so, for many patients, especially during treatment when energy and time may be limited, these types of foods can actually be very helpful and practical options. So, when we say processed foods, again, a lot of foods are processed in some type of way. Whole grain breads, frozen vegetables, tofu, soy milk, like lots of these are would be considered quote unquote processed foods. Ultra processed foods are a bit different, and that's why we add the word ultra. They're typically made from more refined ingredients, maybe more additives. They're designed to be very convenient and highly palatable. And a lot of the times, a lot of the nutrients have been removed as well. So again, the key message is not to avoid all processed foods, of course, because as we just said, there's lots of processed foods that can be nutritious, because that can be quickly become overwhelming and restrictive for people. So that's why it's really more about building a pattern that includes more minimally processed, nutrient-dense foods, whole foods when possible, and allowing some flexibility for convenience, appetite, and what somebody can realistically manage. So foods like yogurt, nut butters, tofu, whole grain breads, frozen vegetables, again, these are all examples of processed foods, but that can be absolutely part of a healthy, supportive diet. Antioxidants and phytochemicals. This is why, again, we're always, shouting at people, not realistically shouting, but telling people till we're blue in the face to eat more fruits and vegetables and things like herbs and just more plant-based foods in general. But these play a key role in reducing inflammation and supporting immune function, and, especially particularly during treatment. Um, of course, cancer itself, and along with treatments such as chemo and radiation, can cause increased oxidative stress in the body. This means that there's an imbalance between damaging molecules, which we call free radicals, and the body's ability to repair that damage. So, over time, this can lead to fatigue, inflammation, slower healing, things like that. So, antioxidant phytochemicals, which are natural compounds found in colorful fruits and veggies, and even herbs, teas, and some whole grains can help the body cope by supporting the immune system, helping to regulate inflammation, may assist in cell repair and recovery from treatment, and may even help the body manage hormones and stress responses during challenging times. So this is why, again, more fruits and veggies, more color. We're always telling people to add more when you can. Now, we're talking about food-based antioxidants here, not high-dose antioxidant supplements. Some supplements can interfere with how treatments work, so it's best to stick with whole foods, of course, unless otherwise advised by the cancer care team. And calcium we often discuss in the context of prevention, but it's also really important during cancer treatment. And there's a few reasons why this becomes relevant. Certain therapies, like steroids, which are often used to manage side effects, or certain systemic treatments, can affect bone health over time. In addition, reduced activity levels, changes in nutrition intake, overall deconditioning during treatment, all of these can kind of impact bone strength and bone health. So ensuring adequate calcium intake is important for supporting overall strength, maintaining bone health, and helping the body stay resilient as possible during treatment and recovery. The general recommendation is around 1100 to 1200 milligrams per day. And can come from a mixture of different food sources. Dairy foods contain about 300 milligrams per day. So this is why we're always saying dairy is an easy source to get calcium. But also fortified, like plant milk alternatives, like almond beverages, cashew beverages, soy, oat, all those things are typically fortified with around the same amount of calcium. So can also be an efficient way to meet needs. And then there's also more plant-based sources like tofu, almonds, seeds, leafy greens, certain beans. These can contribute as well, but they tend to provide smaller amounts per serving, so about 100 milligrams or less. So it just takes more planning to meet needs through those foods alone, if that is somebody's preference. And I just wanted to make a comment too. I'm always a huge proponent of get it through the diet first if possible. But if not possible for whatever reason, then that's when a supplement might be considered. But again, it's always important to check in with the care team or dietitian first to make sure that it's appropriate. It's not going to contraindicate with their care, and of course, avoid taking too much. So alcohol, again, like these recommendations and guidelines have changed over the years. We know from strong evidence that alcohol consumption increases risk of developing certain cancers, including colorectal cancer. The risk increases with higher intake, but there isn't really a completely safe level when it comes to risk, and that's kind of been communicated in the past few years. And that's why, it can be a sensitive topic for some because, some people do enjoy it, right? When we talk about 10 to 20% of the diet being foods that we enjoy or convenience foods, that's going to look different for everybody. And sometimes, alcohol might be in their 10 to 20%. So it's important to approach it in a realistic and non-judgmental way. But the current recommendations suggest that if someone chooses to drink alcohol, keep intake as low as possible. Um, this is kind of reflected to mean no more than about two standard drinks per week. And after a cancer diagnosis, the recommendation does become a little bit more cautious. Ideally, avoiding alcohol altogether is recommended. But if someone does choose to drink, keep it very limited. Again, no more than about two drinks per week is, a reasonable recommendation. Um, and from a coaching perspective, this is where a harm reduction mindset is going to be helpful. Not everyone is going to eliminate alcohol completely, and just like other things as well, and that is okay. So the goal is always to support patients in making informed, realistic choices that align with their values and their situation. So you might have to explore things like reducing frequency, choosing smaller portions, trying to see if there's something else that can be replace it, or recommend that they work with some type of like counselor or psychologist that could help with reducing intake if that's needed as well. So immunotherapy, these next two slides just talk about a little bit of emerging research in the past few years. So immunotherapy is an important and growing part of cancer treatment for some patients. Like many treatments, not everyone responds in the same way. And one area of emerging research that has been getting a lot of attention in the past few years is the role of the gut microbiome, which is the trillions of bacteria that live in our whole digestive system from mouth to the other end, and how it may influence the body's response during treatment. And we are seeing that a diet can play a role here, and diets that include more fiber and plant-based foods, things like fruit, vegetables, legumes, nuts, whole grains, are associated with a more diverse and beneficial gut microbiome, which may help support immune function. On the other hand, diets that are high in ultra processed foods like packaged snacks, sugary drinks, highly refined foods may be associated with a less favorable microbiome and potentially reduced response to certain therapies. And again, especially if, people are in both columns, right? Not enough fruits, veggies, plant-based foods, and excessive amounts of foods in the other ultra processed foods category. Um, Probiotics are often kind of talked about in this category as well. And while they're often marketed as beneficial for gut health, some research has shown that certain probiotic supplements may actually be associated with less favorable responses to immunotherapy, possibly because they reduce the natural diversity of the microbiome. Um, Now, there's a distinction, of course, between probiotic supplements and probiotic foods. So, probiotic foods like yogurt, kefir, kimchi, sauerkraut are generally safe, in small to moderate portions and can be part of a balanced diet. Though we don't have strong enough evidence that they are going to improve treatment response. But probiotic supplements, on the other hand, tend to contain specific strains in ultra high doses, and their effects during cancer treatment are less clear. Evidence is mixed, and in some cases, it's actually not beneficial. So at this point, routine use of probiotic supplements isn't generally recommended unless, of course, advised by the care team. And this is, of course, again, still an evolving area of research. And what it does reinforce, again, is that overall dietary quality matters, and that nutrition can be one of the ways that, patients support their microbiome and then thus their body during treatment. Another area that is getting a lot of attention in research right now, but has really been for many, many years as well, is the role of muscle mass during cancer treatment. So we know that many patients with colorectal cancer, especially those going through treatment, experience a loss of muscle, which is called sarcopenia. And this isn't just about strength or appearance. It has, of course, real clinical implications. Patients with lower muscle mass are more likely to experience more side effects from treatment, reduced tolerance to chemotherapy, and just overall poorer outcomes. So again, this is where nutrition becomes really important. Ensuring patients are getting enough protein and overall calories can help slow or prevent muscle loss. And when appropriate, even light resistance or strength-based activity can help support this further. So this is, yeah, just something that's been talked about a lot more recently. It's not just about weight, which is also an important aspect, but body composition and specifically preserving muscle as a way to help optimize treatment as well. And, we talked about some general nutrition recommendations earlier, get more fiber, get more fruits and veggies. But this slide focuses on specific nutrient targets, specifically for protein, fat, carbohydrates, and total calories. So during treatment, and again for cancer in general, the body's energy and protein needs often increase. And this again especially becomes difficult if patients are not feeling hungry or are just for whatever reason are unable to intake the amount of calories and protein that they need. So, we know that healing, inflammation, treatment side effects also raise the body's demand for nutrients. So these aren't numbers that you have to remember, but just to give you a general idea. So we estimate calorie needs using a range of, about 20. This is the easier way. Sometimes dietitians will use equations like the Harris-Benedict equation. But this is kind of like an easier estimate and usually aligns also with that equation. So about 25 to 30 calories per kilogram of body weight per day. But that again, this can go up if somebody is recovering from surgery, if they're experiencing weight loss, we want to try to mitigate that, regain some weight, or if they have higher muscle mass loss, or they're physically active. So there's of course factors that are going to affect what that number might look like for somebody. So protein, again, the needs are increased, so it's often around 1.2 to 1.5 grams per kilogram of body weight. Again, depending on the person's situation. But this is just an example for, around a 165-pound woman. This would mean about 100 to 110 grams of protein daily. And this would help reduce potential muscle breakdown called catabolism, support immune function, and help with tissue repair after procedures, or during other treatments as well. Fat should make up about 25% of total calories, which usually works up out to around 50 to 80 grams per day, depending on, again, the person's situation and what their overall intake is. And for carbohydrates, we recommend around 40 to 50% of total calories to come from carbohydrates, which usually works out to around 175 to 300 grams per day, again, depending on the person. So if someone is, losing weight or struggling to meet their needs, of course, a dietitian can help them create, tell them what their needs are, and then help them create an eating plan that can meet their needs and potentially mitigate some symptoms if they are going through symptoms as well and struggling to meet their needs. So next few slides, I just wanted to talk through some common situations that can impact nutrition during treatment, starting with patients who might be undergoing surgical treatment. Nutrition, of course, is going to play an important role in recovery, but also going into surgery well nourished can really help reduce complications, support healing, and just improve overall outcomes. If a patient has experienced weight loss or signs of malnutrition leading up to surgery, they really will benefit from a short-term plan to increase calorie and protein intake beforehand. This is often referred to as prehabilitation. After surgery, it's very normal for digestion to be a bit more sensitive. The body's healing and patients may need to temporarily adjust things like fiber intake, either lower in a lot of cases, portion sizes or types of foods to make eating more comfortable. And again, everybody's unique and different. For some people, they bounce back a lot quicker. Some people, it takes 4 to 6 weeks. Some people, it takes 3 to 6 months. It really depends on the person and their situation and, their surgery and their gut microbiome and so many different things. But this is why in many cases, a low residue or low fiber, they're kind of, terms used interchangeably, but it's usually recommended for the first 4 to 6 weeks after surgery. Um, this helps reduce the strain on the bowel while it heals. So, again, contraindicative of what we would typically recommend, higher fiber, more fruits and veggies for general population and cancer prevention and general colon health and all those things. We might recommend foods like white bread, white rice, bananas, well-cooked vegetables, lean proteins, just because these foods are often better tolerated during this time and can still provide the nutrients that the bodies will need. And then after this recovery after recovery and, patients are feeling better, they're, mostly symptom free, then they want to gradually reintroduce fiber and return to a more balanced and varied diet. But again, this timeline can look different for everyone. For some patients, surgery may involve creating an ostomy where a stoma is used to allow waste to leave the body. While the digestive system still works, again, in this case, it typically does need time to adjust after surgery. For patients with an ostomy, once the initial healing period is over, most people with an ostomy can enjoy a wide range of foods again. That said, some individuals may notice changes in how certain foods affect them, especially if they experience high output, constipation, gas, odors, things like that. For a high output, staying hydrated becomes even more important. Broths, electrolyte drinks, salty foods can help maintain fluid and mineral balance. Some may also benefit from eating more starchy or binding foods like white rice or bananas. For gas and bloating, chewing food thoroughly and eating slowly can make a difference here. And for constipation, gradually increasing fiber and staying active can help, as long as it's tolerated, of course. And in some cases, encouraging patients to keep a food and symptom journal can be helpful if they're unsure of what is causing their issues. Because again, everybody's response is different. So some people might be certain foods might trigger their symptoms versus certain food groups for some people. So that's where a food and symptom journal can be helpful. Um, so again, malnutrition, something we must talk about because it's one of the most important and often overlooked issues when we see patients with cancer in general, but with colorectal cancer. One big challenge is that it's not always obvious. So someone can appear to be at a higher body weight, but still be losing muscle, feeling fatigued, and not meeting their nutrient needs. So weight alone, or a visual alone would not give us the full picture. And there's a number of factors, again, that can increase this risk that we've already discussed. So we might see things like reduced tolerance to treatment, more complications, longer recovery times. But keep an eye out on certain things. That's why we really tell people to watch for unintentional weight loss. And by unintentional, we mean their food intake hasn't really changed. Their activity levels haven't really changed, but they're still kind of consistently losing weight, no matter what their body size is. If there's a noticeable drop in appetite or food intake or loss of strength or muscle, these are early signs that someone may not be meeting their needs. And this is where early intervention is really important. So the sooner we can identify these changes, the sooner we can support patients with strategies to help maintain their strength, stay on track with treatment, and get adequate nutrients so that they can heal and recover. So again, unintentional weight loss is a serious concern, but something that we can support through proper nutrition and care. So in cancer care, we use the term cachexia to describe a metabolic condition that causes unintentional weight gain and muscle loss, increased fatigue, and decreased appetite. It often affects patients with advanced cancers, including colorectal cancer, but is especially common in stages 3 and 4. What's tricky about cachexia is that the body burns more energy than usual, even if someone is eating normally or at least trying to. The appetite drops, body starts losing both fat and muscle, which can reduce strength, lower quality of life, and again, make it harder to tolerate treatment. Um, and as of course, I'm sure you know, in our society, many people think of weight loss as a positive thing, especially if they've lived in a larger body or have just had, experiences of their own with, weight loss or diet culture or, body image or relationship with food, all of those things. This is why it's important to talk about and to educate on, because, especially during cancer treatment, even a small amount of um, weight loss, such as 5% of overall body weight, can negatively affect energy, strength, and how treatment works. So, after a cancer diagnosis, weight loss should not be the goal. I mean, I'm sure there might be specific cases if, somebody is working with their oncologist and they're cleared to maybe a little bit might be fine. Like there might be specific unique cases, but for the average person during treatment, even if someone's in a larger body, um, we typically recommend not losing weight because that means that you have to eat less than what your body naturally needs. So this is why if we notice early signs, it's important to take action. And of course, cancer treatment itself can help reverse some of this, but nutrition is still critical in this stage as well. And just getting enough protein and energy dense foods, even in small amounts throughout the day, can help prevent this or prevent further loss, which is important. It's common for patients or their families to ask about supplements during cancer treatment, but it's important to make a distinction between dietary supplements or what we might refer to as oral nutrition supplements because they serve very different purposes and come with different risks and benefits. So dietary supplements include things like antioxidant pills, herbal remedies, high dose vitamins, and minerals like vitamin C or calcium. Right now, we don't have solid evidence that these help or treat or cure cancer, and in some cases can actually do harm. Certain supplements can interfere with how certain treatments work, such as, chemotherapy or radiation, um, especially those with strong antioxidant effects or that affect liver metabolism. So that's why we always advise patients to check with their doctor, pharmacist, dietitian before starting any supplement, even if it's considered, quote unquote, natural. On the other hand, you will often hear of patients either being recommended oral nutrition supplements or just already drinking them, which are these kind of ready to drink protein shakes or powdered add ins. And they can be helpful during treatment. contrary to what you might hear from people in social media or wherever, they can and have saved lives. Again, are we going to automatically resort to these? No, it's kind of like a last case scenario if somebody, and they are, especially formulated to help meet calorie, protein, vitamin, mineral needs. So absolutely, yes, get it through food first if you can, but a lot of the times these will be recommended as an easy way to help people meet these needs and help them to get through treatment and help, prevent weight loss and help prevent malnutrition, cachexia, and those things. And this slide just one, again, you will have access to this presentation, both with a link that kind of shows the slideshow as we go through Canva, but also a handout. So, these you can kind of refer back to. You don't have to remember everything. But just bring together some simple targeted nutrition strategies for four of the most common challenges patients face during treatment. So low appetite, nausea, diarrhea, constipation. Um, Especially low appetite is very common during treatment. And again, these patients have increased calorie needs. So it can be very helpful to encourage small, frequent meals every 2 to 3 hours, along with adding more calorie dense foods like cheese, nut butters, avocado, higher fat dairy products, or again, in some cases, things like muffins, if that's something that they will tolerate. But smoothies are great too, trail mix, those types of things. Um, for nausea and vomiting, bland, soft foods like toast, crackers, rice, broth are often better tolerated. Again, eating small amounts more frequently, sipping fluids throughout the day can also reduce discomfort. So I won't go through them all, just kind of going through a few of each category, just to make sure, again, I finish up in a few minutes and give us time for questions. Diarrhea can, of course, be related to things like treatments, medications, surgery, so many different things. But focus becomes on hydration and replacing lost electrolytes. So encourage room temperature fluids, foods that provide sodium and potassium, like soups, pretzels, bananas, limiting caffeine, greasy foods. Sometimes dairy in certain cases, depending on the person, can help. Um, and for constipation, the approach will be a bit different. So increasing fiber and fluids together is typically helpful. So your fiber-rich foods, fruits, veggies, whole grains. But without enough fluid, fiber can actually make symptoms work because they fiber and fluid really work together. So it's really important to make sure fluid is increased in this case as well. And light movement like walking can also support digestion, and help with some of these symptoms as well, particularly constipation. Of course, if symptoms are ongoing or making it difficult to eat enough, then that's a really important time to, encourage them to involve cancer care team or registered dietitian for this more individualized support. And as always, it's important to not talk about just what to eat, but how we relate to food. One thing we're seeing more of, especially on social media, the past 5 or 10 years, is this push towards clean eating, cutting out sugar, carbs, oils, anything kind of seen as impure. And again, like aligning with this misinformation that we're seeing as well. While choosing whole nutrient dense foods is absolutely helpful, becoming overly strict or fearful around food can backfire and actually harm a person's physical and mental health. So, this mindset, especially when it becomes extreme, like they've kind of termed or coined this term called orthorexia. And it's really like a hyperfixation on food purity to the point where it causes stress, restriction, or even isolation. And of course, for cancer patients, they're often anxious, looking for control. This fear-based messaging can be especially persuasive. So, if someone is eating enough calories, over restricted, sorry, even if someone is eating enough calories, over restricted diets could lead to nutrient deficiencies, gut issues, hormone imbalances, and just, unnecessary anxiety. So it's just always important to talk about, right? If you hear patients Or even friends or colleagues saying, I'm cutting out all sugar or carbs because I heard they feed cancer, or any kind of messaging like that. Those might be signs of this like misinformation, informed, disordered eating creeping in. And again, encourage maybe to speak with a dietitian or somebody trained in eating disorders or disordered eating, especially if, again, you're seeing it as something as extreme. This slide looks at something really important, factors that affect health beyond just food or medical care, things like income, housing, education, access to food, social support. So many things can all influence how well someone is able to eat, follow recommendations, and get through treatment. For example, someone may know what to eat, but might not be able to afford it, access it, or prepare it. Others might be dealing with fatigue, lack of support, or challenges in their environment. So when we're supporting patients, it's important to look at the whole picture, not just the choices that they're making or what's on their plate. So I don't have time, of course, to go through detail on this, but I would strongly encourage you to learn more about the social determinants of health, which is what this refers to, if you haven't already, just because it is a really important part of providing realistic, compassionate, and effective support to people. And just building on that idea, when we start to understand all the different factors that can impact someone's health, it becomes clear that there's no one right way to approach nutrition. This is where concepts of meeting patients where they're at really comes in and becomes important. So it's so important to remember when supporting someone through colorectal cancer or really any health challenges that everyone is different. Some people might feel highly motivated to make changes and are ready for big lifestyle changes. They're energized, looking for information, open to trying new things. Others might feel completely overwhelmed. Um, and for them, one small change, like drinking an extra glass of water or adding, an extra serving of fruit and vegetables during the day, might be all that they can manage right now. But eventually, over time, those small changes will lead to bigger changes. So it's our role to meet people where they are, not necessarily where we think they should be, right? We give them the information, allow them to make informed decisions, and that means we should be, curious about their life, culture, values, routines, preferences, and then working with that. And this is where, what we consider a harm reduction approach comes in and is really helpful. And we focus on making realistic, supportive changes that reduce stress and help protect patients from misinformation rather than expecting perfection. And just a couple key messages. Again, I'll try to go through quickly so there's time for questions. A message we often hear from cancer patients is that, the feeling that getting cancer is somehow their fault or that they could have done something differently is incredibly common and understandable emotional response. But it's one thing that we might want to gently correct, and important to let them know that, the diagnosis is not something that they did wrong or that they deserved. Cancer is complex. It's not black and white, and it's not as simple as just one factor determining whether or not someone will develop cancer. There are dozens of factors that contribute to risk, and these factors vary from person to person. Some of these factors we have no control over, unfortunately, like genetics, family history, our things like our height or even our environment in some cases. But again, the key takeaway is these factors are not something we can change or blame ourselves for. What we can do is look at what we can change, and focus on those things, making small, realistic, manageable changes to things like diet, physical activity, smoking, alcohol, sleep, stress, those types of things. And that hopefully can help alleviate some pressure from some people. Because self-blame is, it can do more harm than good. Um, again, just with misinformation, I know I've talked about it throughout the presentation. It's very, very common. It unfortunately spreads very fast and it often sounds very convincing. And sadly, a lot of these people have admitted that they know it's what gets their content engagement. So then they lean on that. They start to include more of these buzzwords like clean, detox, inflammatory, toxic, because they know it's what gets likes, engagement, helps, build their page or whatever it is, sell their products, whatever it is they're trying to do. And research does prove and show that misinformation spreads more easily than the truth because it's often more shocking and elicits an emotional response. So really just want people to think more critically. Don't take everything with a grain of salt, right? And always look to these like organizations that we mentioned before that have hundreds of researchers and health professionals and physicians behind them, and it's multiple different organizations, and they're going to put out the best information when it comes to cancer recommendations. So I'm
Felicia,
not going to play these videos.
yeah,
Yeah,
Felicia, I'm just going to jump in. I really want to make sure that our cancer coaches have time for the Q&A behind the scenes.
yeah.
So perhaps we can wrap up the live portion of the presentation, if you have just any kind of last closing remark, and then we'll jump backstage with our coaches.
Absolutely. I'll do that now. So I was just going to say, if people want to click the link that takes to the Canva presentation afterwards, you'll be able to watch these videos, which are really helpful and kind of debunk common misinformation. And then just some key takeaways. Again, I won't go over them because I want to leave time for questions, and it's stuff that we've all talked about. And again, you can refer back to in the presentation. But yeah, we'll just go to questions now because I agree that giving time for questions is important.
Wonderful. Well, thank you so very much, Felicia. Nutrition is something that is so very often under supported in our cancer care system, but also something that can be really empowering for patients if they have the information and the support needed to kind of take control of that a little bit. So for our live audience, this session will end. Again, please rate the session if you're able. We'd really value your feedback. And please return to the lobby in your browser to join us for the next session at 10:45 with Dr. Shadi Ashamala. Felicia and coaches, we will jump backstage for our Q&A now. Thank you.